But yeah, we'll dive right into it. So again, my name's Dr. Grayson or Dr. Kevin from Auto-Ness Physical Therapy, and we have
Dr. Emma.
And then also Brandon here is a student from San Diego State. He's been on his clinical rotation with us. We are located here in Scripps Ranch. And we've been a longtime partner of the Swim and Racquet Club, and we always appreciate coming out here and providing you guys with some good information. So today we are discussing running performance and injury prevention. So a couple quick notes. First thing, we always like to dive into these, talking about what is a fixed mindset and what is a growth mindset. So without reading too much into it, anyone want to give me an example of what your idea of like a growth mindset is?
You never run again.
Yeah, that's true. There's no wrong answers here. Yeah.
I'm more in a fixed category, probably.
Yeah.
I don't know.
Yeah.
At my age, I'm not sure how much growth I got that. But,
Yeah. Well, we're going to challenge.
Yeah.
We're going to challenge that a bit today. So again, a growth mindset, we're just talking about intelligence can be developed, have that desire to learn. So someone who embraces challenges, persists despite obstacles, sees effort as a path to mastery, learn from criticism, and be inspired by other successes. So we bring this up just to say that in all of our workshops, we hope that everyone brings their growth mindset hat today and plans on learning a lot and growing and really moving forward and learning a lot from us. So any questions on that?
on the growth side.
Yeah.
I didn't read the slides.
Yeah.
Well,
Good.
Yep.
The reason I said fixed is because I've been on it for so long that it's like, it's fixed in my mind.
Right.
Keep going. That's all I can say.
No,
So I didn't look at any of it.
we
I
appreciate.
should have known if it was red, it was bad. If it was good.
By association, that's right.
No, we appreciate the clarity on that. And like I said, we just asked everyone brings their growth mindset hat today and plans on learning a lot. So a couple more quick notes. This presentation is for educational purposes only. So, we want to give as much good information as possible, and it's always our goal to get people feeling better. And we will do some movements today. So, if something is hurting or something doesn't feel right, please do not proceed to do that, or give us, raise your hand, and we can discuss other ways to adjust or adapt. Oh, welcome in.
Yeah.
So I say that just with understanding, like everyone's body is different. So if you have more specific things going on, just understand it might take some deeper assessment for that. Okay. Like I said, seriously, I say that we just want to make sure if something does hurt, our main goal is to not hurt anybody. So if we're doing an exercise today, it's too challenging, just let us know. We'll see if we can adjust or make some, or give you something different to work on. Okay? And last thing, I did mention this already, but this is being recorded just so we can send this out and make sure everyone has access to this information and they can watch it remotely.
No bad language.
Yeah, no bad language. We can cut it out. We can edit some stuff.
We're
so
going to edit
it's
some stuff out. Yeah.
Awesome.
Alrighty, so just like Dr. Kevin said, we are doing a running performance and injury prevention workshop. Now I'm guessing if you're here to perform better in your running or walking and prevent injuries in the future. So the outline of today would look like, we're going to talk about common injuries that you'll find in runners. We're going to talk about what is good running form, what is running form, what does that entail? And then we'll talk about how does the foot play into that, mobility specifically, and stepping, and how does that integrate with the whole system of the knee and the hip and the back, and how we can address the whole system and not just look at these pieces of running. Because we know by research that there are trends when you start aging, things start to feel heavier, gravity feels a little bit heavier, getting up from the couch feels stiffer, and you're probably looking at me, and you're like, what does she know about aging? She's probably 28, doesn't know a stiff bone in her body. But when these trends are inevitable, we have to look at what we can change, and that's mobility, that's stability, that's strength, and balance. So those are things that we can change, and what we'll focus on today of what you can change even when these trends are inevitable. So we'll have a live assessment, go through some movements together, kind of look at what your mobility is and how it's talking to the rest of your system. We'll go over exercises and talk about kind of the plan of what we would do if you were in the clinic as well. So starting off with our next slide, before you do the slide, actually, surprise, what do you guys think are the most common injuries in runners? You guys might have peeked a little bit, but if you had to guess, the most common injuries. Okay, alrighty. Well, why do you think plantar fasciitis? By experience? Okay.
Anyone else?
It's always an insole issue.
Yeah.
If you pronate or supinate or pronate.
Yeah. Any other guesses? Tendinitis, yeah.
Knee pain, just general knee pain.
Yeah.
Pronation, you said? Yeah.
Yeah.
Just use it. Insert, right?
Yep.
We'll get into that a little bit today as well.
He's going ahead in the slide presentation. You already peeked at our slides. Yeah, you can always go ahead and flip it. So yeah, lots of tendinitis, patellar tendinitis. We had patellofemoral pain. That's just a fancy term of saying knee pain. IT band syndrome, shin splints, Achilles tendinitis, plantar fasciitis, a lot of itis. What is tendinitis? Do you guys know that term? I know it's a very easy question, but if you had to define it, what would tendinitis be? What does that even mean? We use it all the time. Perfect. Yeah, inflammation of the tendon. How does that happen? Too much volume, overuse, too much load over a period of time. So when we're talking about running, and I'm going to expand this even more with also pickleball, hiking, walking, if you have an inflammation at the tendon, you're adding too much load to a system that's underprepared for it. So that's why we're talking about a system today, because we want to be able to, again, prepare your balance, your mobility, stability, strength to address a volume that's not, that's larger than what you're used to doing. So there's this gap that often leads to tendinitis, okay? So we'll get into running form now to kind of address the first thing of what you can change. Okay,
so running form, we can get like super into the weeds on this. We try to break it down as simply as we can. A couple of do's and don'ts. So when we talk about poor mechanics, surprising to see upright posture is on there. So if we're too upright, that can cause a lot of issues as far as how the body is absorbing that load and your progression forward. Overstriding is a huge one. So looking at this image here, number 1 versus number 2, look how the load is distributed through the body when we have a larger stride versus a shorter stride. So very, very common issue with a lot of runners is particularly as we overstride, and sometimes that's as we increase the speed or try to run a little faster, we might start to leap a little more forward, but that's going to cause potentially something to break down up the chain from there. Hip drop, also one of the number 1 things we see in the clinic when we analyze our runners, and really good image of that on the right here. You can see this person stepping on their right leg here, nice and level pelvis. That tells us that their hip is functioning properly, providing enough stability when they land on that single leg, versus person on the right, they land and the hip drops in. So really common issue that leads to hip pain, low back pain, and or knee pain. So just a couple quick points there. So as far as good mechanics, pretty much the opposite of what we're talking about here. Slight forward lean is going to be key. So getting a little more forward, getting us to help get that propulsion forward. Quicker strides, shorter strides, and neutral pelvis. So we did put a note here, midfoot strike, maybe most optimal, but there's a little bit of nuance there. Majority of us are heel strikers, and it's not always necessarily a problem to strike with your heel, depending on how your body is responding to that. So any questions about that so far? Yeah, correct. And that's a great point, because as we sprint, we tend to get a little more forward lean, and then we're a little more on the forefoot, and that is totally normal. But there are some runners who just have more of a forefoot strike, and the main difference being is if we're landing on our forefoot or the front of our foot, we're going to get a little more load through our calf muscles, which is not necessarily a bad thing, versus a heel strike where we might get a little more forces distributed into the knee. So to be clear on that, if you're having like knee issues with running, sometimes we might tell somebody to lean a little more forward and get a little more on their forefoot. But like I said, there's a lot of nuance in that, and as far as what's going on with someone specifically, it's totally normal to be forefoot, midfoot, or a heel striker, and they can all be efficient and optimal. Yeah, great question. Any other questions on that? Who here thinks they have good running form? There we go, we got one.
Don't worry, we won't make you run.
I said, who here thinks they have good running form?
I can't run, so my form.
There we go. There we go.
All right.
Walking form.
Probably not good either.
Yeah. All right, we'll move on to our next slide here.
Okay, pronation and supination. So John, you had a little bit of a foresight on this. This is probably one of my favorite slides because we talk a lot about pronation, and that is a very heavily used word in society. And what does that really mean too? Do you guys have an idea, without looking at the slide, what that means, pronation? Or what do you associate it with, I guess is a better question.
I associate pronating, so how your thing twisters,
Blisters,
calluses.
calluses. Yeah, like a lot more wear and tear on the inner side. Anyone else? Anyone have flat feet or a pronated foot that they know of? Kevin?
I wouldn't say I have flat feet.
Yeah.
Not recently.
Yeah. Okay.
I'm pretty sure it hasn't gone away.
Yeah. Well, again, as we had talked about with pronation and supination, the thing that people don't talk about is that your foot should be going through supination to pronation back into supination. So we need these mechanics to absorb shock and then stiffen your foot for that push off. So we need these, and I think we hyper-villainize pronation and flat feet and throw orthotics at it or supportive shoes or think that kind of causes pain. Now, it is more so a correlation to pain because if we pronate, then our whole system starts to fail where our knees will collapse in if our hips aren't strong enough to pull us out. So pronation, again, can be correlated more with that hip strength or more so hip weakness. And so again, that's something that we'll look at today about how that pronation can affect up the chain and how that up the chain can affect down as well. So something to keep in mind as we do some of our tests today. Questions on pronation and supination? Perfect.
Hello. Awesome. So another quick point just on what Emma was talking about here. I really like this slide because it gives us a good idea of like how pronation affects the system, right? So if we look at the left here, this woman, she's performing a squat, and you can see she's overly pronating. So as Emma mentioned, it's normal to pronate. However, when we get over pronation, look what's happening at the knees, right? So that can cause a lot of knee stress. And then as we shift over to the right, it can also up the chain lead to your back overcompensating. So really what I like to talk about in the foot is it is the first thing that hits the ground when we're running, also jumping or really walking. And so it's really important to have that control and understanding of what our foot is doing because it can affect things all the way up into your back and even into your neck. So any questions about that slide there?
I'm just wondering, I have a white foot, and I have issues with my toenails.
Mm-hmm.
Walk.
Yeah.
Definitely because they can start fungus,
Mm-hmm.
blood blisters.
Mm-hmm.
Since that's creating acid deposits. Those, and so
Yeah. And to be clear on that, if we have an issue where we can't control that pronation, or we do have a really flat arch or whatever it may be, sometimes an insert or an orthotic is recommended to give you that external support. Because if it is causing things where, like, you know, when nails maybe digging in the skin or causing other, you know, skin issues, we might need that support and continued support to offload some of those structures. Yeah. The orthotics, you mean, or the inserts? Yeah. Yeah. And so, and it is something that I think Dr. and I agree on this a bit, is like, if we can gain that muscular control, that can help give us a lot of support. So with a lot of our runners, we do a lot of foot specific strengthening to really learn how to control that arch and make sure we can fire the right muscles. Because a lot of times if we just put an orthotic in there, sometimes that turns our muscles off and then they just get weaker and might atrophy over time.
Yeah.
So, but yeah, good question.
Yeah. Okay.
All right. We're going to get moving a little bit if you guys are ready for it. Oh, get the blood pumping.
Alrighty,
Yeah.
so we're gonna have everyone stand on up. The first thing that we're gonna look at is a squat, just like we were talking about in the slides before. We're gonna wanna look at foot and ankle, how that affects knees, how that affects hips. So for the first one, I'm gonna have Dr. Kevin show us a proper squat.
Okay. There you go.
Nice, okay, very good. And then show us an improper squat.
Okay.
Okay, and what are you guys noticing? We're gonna look at the feet first. Anything with the feet that you notice happening as he's doing an improper squat? Yeah, turning in, kind of that pronation that we talked about. And then you can see as that goes up to the knees, you see how those knees go in. So yeah, again, adding a lot of that knee stretch, which is why we get a lot of that tendinitis, a lot of the IT band syndrome that you saw in the common injuries above. Okay, so we're gonna have everyone stand on up and we're gonna go over some squats and we'll look around too to see what you're feeling. We're gonna look at the foot and ankle and then the knees and the hips, okay? So go ahead and get into squat position and just do 5 squats here. There you go.
Yeah, we're going to come around and we'll...
Oh.
I have an injury.
Oh,
It's hard for me.
Yeah,
okay. Okay.
okay. And this is actually, if John, if you wanna come up here,
John got picked. Yeah.
you got picked. This is a good one. So go ahead and John, just show us your squat here.
Just starting like this.
Mm-hmm. That's okay. Good. So anything that we notice with John's squat at the feet first. So feet are slightly pointed out. You can take a break. I won't make you do a million of these. So feet are slightly pointed out. So that usually tells us then hips are stiff because they want to peek out. They also can tell us that your knees might want to go in. So we want to gain a little bit more rotation to help give us some more support. And then I was also noticing too, that John a couple times would lift his heels. So that can tell us too, ankles are stiff and or maybe we're using our quads and our calves more to impact or absorb that impact more, okay? So
We don't pay attention to it.
I know, a lot of people don't. It's a very easy one to think about. So, so I would, for John, I would widen his stance a little bit more. And then I'm going to tell you to go more on the midfoot or the heel and push your butt back. Right kind of at the shoelaces, right there. There we go.
Nice.
So just a few touches, a few fixes, just to get the right muscles going. How does that feel, John?
Yeah, just can't bend it.
Good.
Yeah. That looks good as far as the way your knee is tracking.
Perfect.
So what we really want is to make sure that these aren't diving in or driving out too far.
Yeah.
So
And then
you're
you said
getting
you have
your
an
butt back
injury?
pretty far, which is good, which means we're getting the glutes involved a bit more.
Oh, okay.
Yeah, really good. How long ago was the
Oh, okay.
surgery?
The next movement might be a good one to look at for you. It won't be too strenuous. Yeah.
Yeah.
It's the second time I've had the surgery.
Yeah. Okay.
This time I hope it works.
Yeah. Definitely. Okay. Next one. If you guys want to try this one, we're gonna see what your balance looks like. Okay. So a really good test of really single leg stability and single leg strength. Okay.
You want it straight out?
No, it doesn't matter. You can kind of just keep it bent. But as the image is denoting, want to make sure we have a good level pelvis. So what I'm going to have you do when you're standing on that leg, think about squeezing your butt a little bit. It helps keep the hip up versus just letting it hang down.
Yeah.
Okay? And it should help improve your balance a little bit by holding a little bit of a squeeze.
Yeah, and this is a good one to also see what your foot is communicating with the ground with.
Yeah, good.
That does help.
Yeah, and you're nice and stable, right? Help improve the balance a bit there.
Yeah.
But also take note side to side differences, right? Maybe I can stand for 10 seconds on my right, but then the left, it's like 3-4 seconds that I'm losing it. We might be identifying some asymmetries here and things that we want to target and make sure we can even that out.
What about these shoes? They tend to.
There's a lot of support.
Well,
And
actually, there's not as supportive. They don't provide as much support as
Okay.
some people. In other words,
they kind of wobble back and forth. Yeah.
Is that okay?
Yeah. And we actually are going to get into shoes a little bit later as far as running shoes go. But good question on that. So TBD on that. Yeah. Good stuff.
Yeah.
Awesome. Well, why don't we'll go ahead and have a seat after that one. Any questions or comments just about, single leg balance and or the squat mechanics? Everyone feel good about that one? Good. Okay. So we're actually going to have you guys come back up again.
Just kidding.
Yeah, we want to look at some ankle mobility movements here. Okay. Now, the image denotes here kneeling, but we can also do this one standing. So if you guys want, we can actually have everybody come on over here. We're looking at how the ankle is moving. Okay. So we're going to actually go into the wall here. And we're looking for side-to-side differences. And what we want to look at is how close I can get my knee to the wall. So I don't really care what you do with your back leg, but really we're just driving that knee over, and then we're going to check the other side and see if we feel any differences there. Okay? Yep, so hands on the wall, one leg in front, and let's drive your knee forward.
And this is a good point here. Try to keep your
heel down as well.
Because that's going to give us a good measure of stiffness either through here or even some
heel's
calf
coming up there,
tightness
John.
right there.
Try to keep that down and then see how far you get. Okay? Yeah, there you go.
Nice. Let's see the other side here. Ooh.
Yeah. Oh, sorry, it doesn't have to stay flat, but keep that back foot, at least the toes.
How does that feel side to
try
side,
the
Charlie?
left one now.
Side, what do you mean?
Oh, how's the right side?
Side?
Yep.
Weird thing is,
Yeah,
it
so a
feels
little
better
tighter on that left side.
on this one
I was going to say it
than
looks
does on this
better
one.
on your
I
left
thought
side
it would be a lot better on the
than
right.
your
So
right
keep that
side.
heel wants to come up.
Yeah.
Weird.
Yeah.
Good.
Why are you thinking that maybe on the left side
Yeah.
it would
And
feel?
what are you feeling there,
Well,
Don? You feeling a
because
stretch in the calf?
Surgery and
Sure.
just the fact that I have, I think. the
Yeah,
right
so a little
side
bit,
is
you're a
much
little bit
stable
stiffer on that left side.
Mm-hmm.
So this would identify that maybe that left ankle is a little tighter than the right, and something we want to work on.
Yeah,
stretching
so that
calf or
is
working
going
on
to
that
tell us, because
ankle
you talked
mobility.
about some injuries on your right side
Yeah.
knee, yeah? Is that more long
see, that one
standing than the
almost
left side, or
touches
is
the
the left
wall
side
there.
more long standing?
The right side is more.
Okay.
Yeah.
So that tells us on the right side, it's giving us a good
Okay,
scope
we'll take a break
into
there.
the history
Good.
that
So this is not
the
only an
ankle
assessment,
being
this
stiff
can also be
could
an
have caused
exercise.
the right knee to flare up way, way long ago. And so something I would work with you is more of that ankle mobility to
Yeah.
help
They
give
got
more
there,
room
the
to
heel
your
came up a
knee.
little bit. Good. A little wobbly.
So I would say for someone like you,
Yeah.
it's definitely
We
ankle
can head
mobility
back over
issue.
this way.
We would have to look at a little bit deeper if it's also hip too.
All right. So that one's a little more, like I said, the image here we have is more of kind of a lunge position. So you can actually do this one down on the ground if you're able to kneel and then drive that knee over your toes. So as I was telling John here, it's not only an assessment, it can also be an exercise to really work on driving that knee over your toes. Okay? And any questions about that exercise specifically? Yeah. No, that's okay. Yeah, I'm not going to have you guys do the kneeling one. I was just saying that's another way to do it. Oh, the kneel. Yeah, so just like the picture here, you're just kneeling down, and then I'm driving my knee over my toes as far as I can, and I'm just driving in and out here. Yeah, so my heel is staying down is the important piece, right? I can get a lot further if I bring my heel up, but that's limiting. I'm not really getting much of a stretch there. So here, I'm getting a good feel for how much range of motion I have, and we'll talk a little bit more about kind of how that's important and what that range of motion kind of means for you.
Yeah.
So.
Yeah. I did want to add another thing about the proper squat mechanics. One thing that that we look at a lot with our clients too, I'm going to take off my shoes really quick so you can see this, is that when we put you in a better position, I want you to look at my feet here. Say if my knees are caving in because I'm pronated, if I push my knees out, you can see how that naturally brings an arch to your foot. So when we kick on our hips, so this putting your knees out, you can even do this too. If you push against your hands here, you should feel your glutes. Your glutes are in charge of creating that arch down the chain. So the more we strengthen down here, the less, or the more control we'll have at that pronation, okay? So that's something to think about as well as we were talking about why a squat is so important.
Okay, so kind of changing gears a little bit here. Just want to get into a little bit about the running shoe. It doesn't have to be specifically a running shoe, it's kind of shoes in general. As you can see here, there's a lot of things, right? We can adjust a lot of different things here, but really the ones that I kind of want to focus on mostly, we're talking about the rocker and the drop, which actually aren't listed up here, but I drew a couple lines on the shoe to denote the rocker and the drop. So the red line here is actually the drop. And so that means it's the slope from the heel to the toe. What you'll find with a lot of running shoes, they're gonna have drop anywhere from like 4 millimeters up to like 9 millimeters. 9 millimeters meaning we're gonna have a significant amount of drop, which can help you in a lot of ways, but it can also lead to compensations. So basically, you're just going to put your foot in a more plantar flex position, which can put a little bit of less, or it can stretch your calf a little bit less and kind of help propel you forward a little bit. Okay? The rocker is really that, you know, kind of boat shape from the heel to the toe. So Hokas are probably the most famous shoe that have a significant amount of rocker. It basically is going to help propel you forward and makes that a little bit more efficient. However, it's also giving you external assistance, which might be shutting down some of your muscles from actually engaging or working there, okay? So far, any questions about drop or rocker? Okay. A couple other things, much less important, but you talk about the heel counter and the toe box. The heel counter is just the firmness of the back of your shoe. It can help with the medial to lateral support. So there's all different levels of soft versus firm, and it really depends on like the surface you're walking or running on and what is kind of comfortable for you. And for the toe box, we just always promote a wider toe box if we can, because most of our shoes are pretty narrow and it crams our toes in there like this, which can lead to like bunions and other things like that. With all that being said, what a lot of the current research has found about shoes is what matters most is it comfortable? Doesn't matter how much rocker, how much drop, if it's carbon fiber, whatever the thing is, what matters is that it's comfortable to you and you feel good running in it. So a lot of complicated factors, but let's just make sure we're wearing comfortable shoes. Any other questions on that?
I have sort of a general question.
Yeah.
I haven't actually been able to run for a while.
Yeah.
But I'm using the same shoes I ran to walking.
Mm-hmm.
Is there a difference about the function of the shoes with running in them versus walking?
That's a great question. Not necessarily. I would say it's a bit more person specific, but
And or if it's comfortable. I mean, I still.
correct.
I mean, I'm just wondering if I need to walk in my running shoes. You know what I mean?
Yeah.
Like these are not my running shoes, but when I typically walk, I wear the shoes.
Like running shoes.
I used to run.
Yeah, and I think that's a good thing. Like again, if we're walking, especially for exercise, it's good to have a comfortable, supportive shoe. Versus me, I have these very minimalistic shoes that have almost no support. So if I walk really long distances in them, my feet tend to get a little bit sore. So now for daily activities and work, it's like totally fine. But walking in running shoes can be a good thing to do. But let's just make sure, like I said, it's comfortable and it's not like causing any blisters or it's not too unstable and for all these kind of extra categories. So, a good question.
Yeah, that's a good question.
Okay. So, as far as treatment goes, when we're talking about running-related injuries, really it's about finding and understanding the cause. That's really number one defense. If you have knee pain with running, with walking, what's happening and why? So, as far as getting checked out or getting an assessment, that's seeking out a medical professional, whether it's your doctor, your physical therapist, or whoever, that can help find that underlying cause of what's going on. We talk a lot about foot positioning. We talked a lot about that today. Dr. Emma was talking about how the foot affects everything up the chain, not just injuries in the foot, but the foot can affect injuries in your hip and your lower back. Restoring range of motion is going to be key. So once we identify if there's any limitations, we talked about ankle mobility today. If there's a limitation in your calf, that's going to lead to you running a different way. You may be compensating around it, which can lead to other injuries. So addressing that is going to be key to preventing injury. And then strengthening. Probably our number one defense here is working on strengthening the areas that are weak. And what we often see with running, it's the hip, so the glutes, your quadriceps, hamstrings, and your foot. We talked about most of these today outside of like the hamstrings and quads, but everybody knows these are your big muscles on your upper thigh. And it's going to be very important to make sure they have good strength and stability to really help get you moving forward. Okay? And again, I said at the end there, seeking out a medical professional is really going to be our number one defense to really identifying what's going on. Okay? So same thing, now we talk a little bit more about prevention. So now we're talking about we're injury-free. How do we stay injury-free? Well, listening to your body is number one. Everybody knows their body. You know your body better than anybody else. And so, obviously if you need a healthcare professional to address if something is going on, then let's do that. But listening to how your body's feeling, are you running too much? Are things starting to get aggravated or overused? Okay. Proper warm-ups and cool downs are super important. Not just running a marathon from getting off the couch, and also not just sitting in the car and driving for 2 hours after you complete a run or walk. Right. Let's make sure we get a proper cool down. Stretching can be key. We like a bit more of the dynamic stretching So making sure we're doing some active movements or active stretching versus just like a hamstring hold. Proper footwear. What do we say about proper footwear? What's the most important thing? Comfortable, all right? Comfortable footwear. Okay? Nutrition, hydration, these are always very key, often very overlooked aspects of your health. Making sure we're drinking enough water. Sounds very simple, but I probably tell this to every one of my patients in the clinic, and we check in on how much how much water they're drinking, what's their intake, and making sure we're up to that standard. Okay? Engaging in a variety of exercise. So really making sure we're doing different things. We're not just doing the same thing all the time. This is a big problem with a lot of our runners, is all they do is run and nothing else. So, you know, we want to make sure we're supplementing that with some strength training, some mobility work, could be yoga, pickleball, just different activities to expose your body to different movements, so we're not really going over that tolerance, okay? And weight loss, major thing with a lot of runners is losing weight helps just build efficiency and reduce the load and the stress on our body. So yeah, any other questions on those topics? Oh, and last piece here on prevention, a little more nuance as far as like we talked about seeking out a medical professional. Running assessment is something that we do in the clinic. So getting people on the treadmill, making sure we're analyzing their gait and seeing if there's any efficiencies or any compensations. However, I think we both agree that it's most ideal if we don't have to change your running mechanics. There's a lot of things we can identify just on strength, range of motion, and how you're compensating, that if we address those things, we might not need to change anything about how you're running, and we can just run like normal. Because it is very hard to change something that we've been doing for 30 to 40 years. And it's ideal if we can just work on strength and mobility there. Okay? Q angle, we didn't really talk much about this, but essentially it's the angle from your hip to your knee. So from here to here, if we have an increased Q angle, that's a higher risk of injury. Okay? So women in particular have a higher Q angle than men, just because they typically have wider hips and a wider pelvis. So they are at a little bit more risk of developing that knee or hip pain with running. But men are not, men can still get that too and still have an increased Q angle. So it's something we look at as part of our assessment. Where I talked about foot positioning, we talked about hip drop, inefficiency. So again, a little bit nuanced, like we say that a mid-foot strike or a forefoot strike is a little bit more efficient. But something like 70 to 80% of runners are heel strikers, and a lot of them have no injuries. So it's not a bad thing to be heel striking. Okay? We talked about muscle imbalances, so making sure we're addressing those, and steps per minute. So another metric we like here also is cadence. So something we measure as runners is getting a higher cadence. So earlier we talked a bit about making sure we're keeping a shorter stride. The way we still get our speed up with the shorter stride is a higher cadence. So how many steps are we getting, per minute? So, and like I said, again, my disclaimer here is always seek out a knowledgeable professional. We like to give as much information as we can, but if there's any kind of deeper questions in there, it's really good to get checked out and make sure we can address all these strength and mobility deficits and get things moving forward. So, yeah. Any other questions on injury prevention? Good.
I think it's a really important note that Dr. Kevin makes, in that getting a proper biomechanical running, a walking assessment is really, really important. That's something that we do often because everyone is so individual. You can't just say, oh, you have pronation, let's fix it with this. It really depends on what you've been doing prior, what kind of activities you want to get into. Are you doing multiple sports? Are you just walking? Are you weight training? Whatever your goals are, we really take that into account. So again, really getting a medical professional to look at these nuances is going to be key to this.
Yeah.
Like with women and Q angle, like what are some exercises that they can do to provide knee injuries?
Yeah, that's a great question. So just like we had talked about earlier with the pronation and that leading to the knee going in as well, again, hip strengthening, putting you in a position where you can have a little bit straighter leg. Again, it's not inherently bad that you have a Q angle, but what does that tell us about the system that you are walking, running, hiking in? So that's why we see maybe a little bit more ACL injuries in women as well too, because the pivoting and cutting, they don't have enough hip strength to do those. So going from double leg, training that, going to single leg, training that, okay, now we're doing jumping, now we're doing running and more impact. So that's what we would do instead. Yeah, good question.
Awesome. So that really kind of concludes our information today. So we want to leave a bit of time just for any questions you guys have on any of the stuff that we went over today, the exercises or injury prevention or running mechanics. So we'll open the floor to you guys. Any burning questions for you at the moment?
We want to get toward